Good. Okay, Jeff. So this is for anterior vertebrae that you don't want to put your fist in the back and crunch down on the patient. I use my leg because I get a lot of movement in the scapular region. It'll open up the SC, the AC joints, the GH joints, the scapular joints, the thoracic, also the rib articulations too. It's a great maneuver. And you just do your regular palpation. What you want to do is you want to identify, obviously, the area that's kind of sunken in the middle portion of the spine. That denotes that the vertebrae is translated anteriorly. And so what I'll do is I'll just simply have the patient sitting on the edge of the table, and I will palpate down. When I find that there's a little bit of a divot in their spine, sometimes that's a tender area because the ligaments are being pulled forward, so it's going to be a little bit sensitive. So I'll identify that. It's best to do it for probably T4 and lower. You can probably get a real good set on T4 through maybe T9, T10. Lower than that, I have to use my hand and roll her back. And higher than that, I'll usually do prone lateral movements with her head and neck. But this is a great adjustment for bringing anything that's anterior back. So I've palpated, there's a vertebrae that's slightly anterior. It's probably around the fourth vertebrae. I'm going to ask the patient to take their hands, put them behind their neck, and I show them, put your fingers together, clasp them together, put them behind your neck. Make sure it's down in the lower portion of the neck area. Then I'm going to sit behind them and I'll have them roll forward slightly, and then I bring them back onto my leg. And I want the area that's anterior to be pretty much in the middle of my thigh. So I've got that area there. Then I ask them to open up their arms, keeping their fingers interlocked. It's real important that they keep their fingers interlocked. And then I'm going to thread in between their arms. So their fingers are locked, my arms go through. I roll them. Sometimes breasts get in the way. Let them know you're not trying to fondle them. Roll them to the other side until you get a good grip on the ribs. Once you have their ribs, then you can start to slide down. So let them slide down so you feel that area, which is that anterior vertebrae. Sometimes just with a little bit of a counter pressure of their arms going forward, the vertebrae will move. So I'm going to ask them then to bring their elbows in a little bit so they're pressuring onto my arms now. I'm going to pull them up, lift them back, arch them, and then I push down with my forearms like that. And that releases really, really well. So it's technique driven. You really have to practice it a lot in order to get that thing really squared up. But it tremendous amount of results. So try it, practice it. If you need another video, if you want a little bit more confirmation on it, any other angles that we need to take with the video camera, let me know and I'll be happy to send it to you. Take care.